We have today Dr. Tom. Dr. Tom is 61 years old, been a patient for 11 years, and he started on testosterone replacement therapy in March of 2006, which is close to 3 years ago. So what were the problems before we started testosterone replacement?
I experienced some fatigue. I experienced a lack of energy. I experienced actually a lot of sleeplessness at the time.
From anxiety, was that, do you think?
Probably anxiety or thoughts running through your head. I had some mild depression. I don't think I was thinking as clearly as I am now. And I was concerned about my diabetes condition.
Also, what about your libido at that time?
Oh, the libido was probably, I would say, non-existent at the time. It was take it or leave it. It wasn't a major concern at the time, but now that it's totally reversed.
We'll get to that.
We'll get to that.
And you're a type 2 diabetic.
I am a type 2 diabetic.
Your diabetes began at the age of 40.
Correct.
And of course, it's my conviction that every type 2 diabetic is deficient in testosterone. I think that will ultimately be proven to be the case. You were not well controlled when we started. You were not really poorly controlled. Your glycohemoglobins, for those who want to know, have always been in the low 7s. So it's not terrible control, but not what we would call good control. So then we started you on testosterone in March of '06, and what happened then?
It took a while for some benefits to occur.
How long?
It took about a period of about 4 months before I noticed some changes. The libido got better. But I really didn't believe it at the time, so I went off testosterone therapy for a short
besides the
time.
libido getting better before you interrupted the therapy, what about your mood swings, your depression, your anxiety, your energy?
I didn't notice a significant change in the energy levels at that time, and I didn't notice a difference in the depression status either. So I came to you and I said, well, I didn't tell you, but I just stopped therapy for a little while.
Okay, and what happened?
And then I realized my libido was less. So I mentioned that to you, and you said, of course, you haven't been here and had your testosterone, and your testosterone are low. So I believed you, and I went back on therapy, and I was a good boy since then.
And what's happened?
And my libido's through the roof. My positive outlook is fantastic, even though the economic times don't call for that. What else? I have a good energy. I don't need as much sleep.
The depression and anxiety?
Depression and anxiety is non-existent now.
Non-existent. So with a regular dosage regimen, everything that was wrong just turned around and went away, basically?
Yes, that's correct.
So a very positive effect. But not so on the diabetes.
Well, that's because I'm supposed to be diet controlled, and I don't do that too well. So we made a deal that come January, if I don't lose 20 pounds off my weight, you're going to start me on insulin. I'm not too thrilled.
Which I've been telling you need for how long?
Telling me for quite a few years.
Okay.
I've just been pushing it off.
Testosterone replacement definitely helps diabetes, but only to a certain degree. All the other factors to control diabetes have to be done also. Okay, so anyway, I'm very glad to see you so perky and horny. That's how we all want to be.
Okay.
And
so when I'm on YouTube, the world's going to know that Dr. Tom is horny. Well, that's very good.
Well, you
Barry.
said so.
Okay.
Okay, thank you very much.
Thank you very much. Thank you.